Okay, guys, I have a bonus one for you tonight. It is discussion E. Discussing public programs are the backbone of aging with dignity in the United States. It traces nearly a century of policy development from the Social Security Act of 1935 to the modern administration for community living to show how these programs collectively form an aging network that supports income security, healthcare, long-term services, and supports LTSS, elder rights, and community living. The article stresses that these systems did not emerge accidentally. They were built through decades of advocacy, often led by social workers, and now face unprecedented threats from proposed federal budget cuts and structural uh, reorganizations. Key programs in historical context. The article walks through the major pillars of U.S. aging policy, showing how each one filled a critical gap in older adults' lives. Okay, number one, Social Security. 1935 created a foundational retirement income program, later expanded to include survivors, spouses, and disability benefits. An essential safety net that keeps millions of older adults out of poverty. The Older Americans Act, 1965, established the Administration on Aging, state units on aging, and later area agencies on aging, creating a nationwide infrastructure for nutrition programs, caregiver supports, transportation, case management, and community-based services. Medicare, Medicaid, 1965, transformed access to health care and long-term care. Medicare provided near universal health coverage for older adults, while Medicaid became the primary payer for nursing home and community-based services. Okay, the National Institute on Aging, 1974, and subsequent research investments advanced scientific understandings of aging, dementia, and chronic disease. Okay, the nursing home reform law. 1987 established resident rights and quality of care standards, reshaping long-term care oversights. The National Family Caregiver Support Program in 2000 recognized caregivers as essential partners and provided respite care training and supports. The Administration for Community Living 2012 unified aging and disability programs under a single umbrella, strengthening the philosophy that people of all ages and abilities deserve to live independently in their communities. Although throughout the article underscores the pivotal role of social workers. Frances Perkins, Grace Abbott, Bill Beachell, Jeanette Takuma, Fernando Torres Gil, and others who shaped these policies and ensured they reflected values of equality, autonomy, and community support. Current threats described in the page. The article warns that many of these hard-won programs are now at risk of being dismantled for severely weakened. Based on leaked OMB documents and recent federal proposals, the threats include cuts in staffing, reductions at the Social Security Administration, worsening delays, and limiting access for millions who rely on benefits. Deep Medicaid cuts, projected to push millions off coverage and slash funding for long-term services and supports, particularly devastating for older adults who depend on Medicaid for home care or nursing home care. Dissolution of administration, dissolution of the Administration for Community Living, scattering its programs across multiple agencies, jeopardizing coordination, oversight, and funding. Elimination of discretionary funding. for aging and disability resource centers, and the State Health Insurance Assistance Program, SHIP, both of which provide unbiased essential guidance on LTSS and Medicare, blocking or delaying nursing home staffing rules despite excessive evidence that understaffing leads to neglect. Preventable harm and power and poorer quality of life. Cuts to elder justice programs include Adult Protective Services, the National Center on Elder Abuse, and long-term care ombudsman programs that protect older adults from abuse, exploitation, and rights violations. Reductions in housing, nutrition, disability, and mental health programs, which would compound vulnerabilities across the lifespan. The article frames these changes not as isolated policy shifts, but as a systematic unraveling of the nation's aging infrastructure. Consequences for older adults and communities. The page emphasizes that the consequences of these cuts could be far reaching and deeply personal. Older adults would lose access to trusted, unbiased Medicare counseling, SHIP, making it harder to navigate complex coverage decisions. Families would struggle to locate or afford long-term care services without ADRC and Medicaid funded supports. Elder abuse, neglect, and exploitation would rise as APS ombudsman programs and elder rights centers lose capacity. Nursing home residents would face greater risk due to weakened staffing standards and reduced oversight. Rural, low income, and marginalized communities already facing disparities would experience disproportionate harm. Cuts to programs for children, people with disabilities, and working families would create lifelong ripple effects, worsening health and economic outcomes that accumulate into old age. The article paints a picture of cascading instability. Without these public programs, older adults' independence, safety, and well being would erode, and families and communities would bear heavier burdens. Advocacy and practical next steps recommended. The article concludes with a call to action. Advocacy is both urgent and achievable. It encourages social workers, caregivers, older adults, and allies to contact members of Congress using NASW advocacy alerts, share personal and professional stories that illustrate the value of programs like Medicare SHIP, ADRC, and LTCOP, and elder justice initiatives. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. Until then, Gator Wellness, take care, folks.